Hi folks, welcome to the first episode in a series called The Chronic Back Pain Roadmap. The purpose of this series is to guide you through finding the right solutions for your pain. As you'll learn, back pain it's highly individual and the advice can be extremely confusing. So what we're going to cover here is going to help you remain informed and in control of things. But before we get into a discussion about back pain, I want to frame this information in the right way. The first thing I want to be clear about is that I'm framing this from the point of view of non-traumatic causes of pain, or what are commonly called chronic pain cases. So I'm not talking about acute pain immediately following an accident or direct injury to the back. This is the kind of pain where it's best to seek emergency medical care when you've suffered something like a car crash, a collision, a major fall, anything that risks fracturing a bone or significantly damaging the body. So I'm not going to be addressing these kinds of issues, but I will be covering chronic pain issues that have been cleared of any sinister and more serious causes. So the next important point to frame this content is that my personal belief is that our health is our own, and it's in our best interest to be involved in our health for two reasons. The first is no one can or will realistically care about our health more than we do. If it all goes wrong, it's our responsibility and we have to live with it. If we can look after ourselves, though, and be responsible for ourselves, we maintain control and our independence, which I believe is extremely important. The second reason is that the medical system is simply not geared towards the effective treatment of chronic, non-life-threatening issues, such as chronic pain. Modern medicine is largely about saving lives and following extreme traumas or disease management. It's not about producing thriving health. And we can get into a big discussion about this and all the flaws with the system and modern society. What I think is more productive to focus on what we can control, and we can control ourselves, at least more than anyone else can. The point is, no one is better situated to ensure our good health than we are as individuals. So I will be framing much of the content of this series from this perspective. Now, let's talk about back pain more specifically. So presumably you have back pain. So you might be wondering, what do you do? Do you go to the doctor? Do you get an x-ray? What stretches do you need? I'll cover this as best I can over this series. The first thing worth considering is, where did the pain come from? Is it possible for you to attribute the pain to a specific incident? The challenge here is that most people will jump to conclusions, and then these conclusions then shape the actions they take. So you might worry that you've slipped a disc, or that your back is out, or that your core is weak and your posture is bad. And as I'll cover in this episode, these are unlikely causes for pain, and they're based on faulty reasoning and myths that persist in our society. So in order to determine the likely cause of the pain without jumping to unhelpful conclusions, we need to understand a few fundamental things about pain and where it comes from. Pain is generated in the brain, whether it's a gunshot wound, a broken bone, a muscle strain, a paper cut, or even a broken heart. Pain is generated by the brain. It generates the sensation of pain based on the information it receives from an injured or strained area, as well as based on past experiences, beliefs, and expectations. So this means that old injuries and your memories of these will influence the likelihood of feeling pain. So if you have fears associated with moving or aggravating a part of your body, these can increase your likelihood of feeling pain. And this is why it's so important to know the facts before jumping to conclusions. The next thing is that pain is not proportionate to the level of damage. A paper cut or stubbed toe can be tremendously painful, even though these are essentially insignificant events. And you can think of the feeling of pain as being somewhat like a smoke alarm. It's going to be loud regardless of if the whole kitchen is on fire or if you've simply burnt a slice of toast. So we can't accurately infer the severity of the problem based purely on the severity of the pain. Now, the fact that pain is created by the brain does not mean that it's all in your head. It doesn't mean you're making it all up. And this is often misunderstood and, if explained poorly, can cause its own problems. Many people come to see me for treatment and they talk of the despair and frustration they felt when they were told their pain was all in their head. Saying this implies that there was nothing actually wrong with them and that they're actually making it all up, and this simply isn't the case. The brain isn't making the pain up for fun, and the creation of pain is not something that we can really consciously override. The brain creates these responses, these pain responses, at an unconscious level, and it does that for a very good reason. It's primarily concerned with our survival, and since our nervous system hasn't changed much since hunter-gatherer times, it's still responding like we're in the jungle, constantly on alert for dangerous threats. Now, this is great for survival, but it also means that the brain will prioritize negative information over positive information, and it will use negative information such as painful and negative past experiences to create its beliefs and expectations. And this might be the belief that picking things up or bending your spine is harmful and leads to pain, or it might be the belief that playing certain sports will aggravate the problem. These beliefs become the filter through which your brain approaches future experiences. The key is to understand that the brain works on this unconscious level, and we need to present it with more compelling evidence. Evidence that overrides the influence of the past negative experiences. Evidence that it is safe to move again without causing pain. And this is a crucial aspect of why movement and beginning to move again is a key component to resolving chronic back pain, but we'll talk about that more in a later episode. Now, let's talk briefly about posture. While it may seem counterintuitive, research has repeatedly shown that posture is a very poor predictor of pain. What this means is that we can't look at a person's posture and predict they will be in pain, let alone where in their body they'll be feeling pain. Now, this does not mean that posture is irrelevant. It simply means that it's probably not as relevant as you might think. Bad posture is one of the most common causes that people assume for their pain, and this in turn leads to people obsessing and worrying over maintaining so-called perfect posture, which causes unnecessary stress and tension. And it also leads to people spending money on all sorts of expensive and unnecessary gadgets that promise but ultimately fail to solve the problem. In reality, posture is quite hard to change, and it's largely maintained unconsciously. This means that your chances of correcting it by consciously sitting up straight are actually pretty slim. But luckily for us, posture isn't as important to pain as we once thought. Again, it's not unimportant, it's just rarely the driving factor behind pain, and I'll look at posture in more detail in a later episode. Now, this next part is extremely important. Spinal discs do not and cannot slip. So a slipped disc, in inverted commas, is not an accurate medical term. It's a lay term that's often used to describe a variety of spinal disc issues, but it doesn't accurately describe these. Instead, it conveys a detrimental idea that spinal discs and vertebrae can simply pop or slip out of alignment. Sadly, the idea that discs slip and that your back can be out of place persists to this day, and this is partly because some doctors and everyday people continue to speak in these terms, and partly because entire industries have been built around the idea that human beings can easily fall out of alignment and require an external force to realign them, such as an adjustment from a chiropractor or other manual therapist. In fact, if forces like those of a spinal adjustment were enough to instantly affect the position of our bones, we would be knocking ourselves out of skeletal alignment with every step we take, and this simply doesn't happen. Our bodies are actually, and luckily, far too resilient for this, but I'll discuss in more detail what is actually happening when you receive a spinal adjustment in a later episode. For now, let's focus on the fact that discs do not and cannot slip. Now, discs can get injured, but as I said, they don't ever slip out of place or significantly out of alignment. In fact, even if you do herniate a disc, this will heal in time, and it isn't necessarily something you need to worry about. This idea that discs slip can be tremendously paralyzing, as it instills in us a fear of moving and potentially making things worse. Someone might say to you, don't pick heavy things up, or you'll blow your back out. In reality, one of the best things we can do is to keep moving as much as we can without aggravating the pain. So again, for now, consider all of this before jumping to any conclusions about the cause of your pain. Now, let's talk about X-rays and MRIs. So if you've been in pain and gotten an X-ray or MRI, magnetic resonance imaging, that's a type of scan, you may have been told that the pain was caused by degeneration or herniation of a specific disc or group of discs. However, research has found that 52% of people have disc degeneration without any pain, and 31% have herniations without any pain. So it's quite possible that the abnormal findings of your scans have nothing to do with your pain. You may have had degeneration for years, while the pain is only a recent and unrelated development. Similarly, you may be in pain now and have absolutely no abnormal findings in a scan. So you can think of this in a similar way to wrinkles on your face. They're a natural part of aging. They occur at different rates for different people, but they're not a cause of pain. The last issue worth considering is that X-rays and MRIs are dependent on the accurate interpretation of the doctor or radiologist. So it's always possible that they misinterpreted the findings or were having a bad day. And this is part of the reason why it's always worth getting a second or even third opinion, especially if you're considering something significant like surgery, or even if your diagnosis is causing you a lot of stress and anxiety. Okay, so hopefully this has given you some food for thought and helped challenge any unhelpful beliefs you have surrounding your pain. I'd recommend taking some time to consider if and how much any of these ideas have influenced your pain. Is your diagnosis based solely around one of these myths? That means, was your diagnosis based solely on an X-ray or scan or on a postural assessment? If so, maybe you've been misled and you have more options available to you. At this stage, I mostly want to challenge you to see things differently and be open to a different perspective. In the following episode, I will explore a more up-to-date and evidence-based way of approaching back pain, and over the course of this series, I hope to lay out a clearer path to your recovery. So thanks for listening. Get in touch if you have any questions, and don't forget to subscribe and follow the Back Pain Coach for all the resources you need to overcome your back pain. Have a good day.